Hi, my name is Julie Boyce. Today I'm going to talk about hypertension, preventions, complications, treatments, and goals. Common illness across the lifespan clinical practicum, FNP 592 with Professor Mackel. Let's begin with what is hypertension. Hypertension is having blood pressure greater than 140/90 or higher. It is a common medical condition in the geriatric population. But as we know in dealing with the medical field, and as we've been going to our precepting sites, we notice that there is just more than the geriatric population out there suffering from this type of illness. This illness has effects on men, women, the young and old. Also, it has affect different populations, different cultures. As you can see, I listed how it affects Black individuals, how it affects the white, the Asians, the Asian American, and the Mexican Americans population. I found a lot of this information in our book, Primary Care for Geriatrics book. And I found it very interesting how they broke it down so we can easily understand what's going on. Essential hypertension is what most people have. It's where the blood pressure rises for an unknown reason. Secondary hypertension is the result from identifiable causes, such as a lack of response to 3 different drug types. And then at the bottom, I have different classifications. You know, normal blood pressure used to be less than 120/80, but as you can see, that's considered prehypertension. And then it goes into stage 1 and stage 2 hypertensions. In diagnosing hypertension, it's important to understand which type of hypertension a person has. Essential hypertension is known as a high blood pressure, which is defined as a rise in the blood pressure of unknown causes. I read in the book that the majority of people that are seeing hypertension are patients who have essential hypertension. Secondary hypertension is from an identifiable source and is known to not be common in the elderly population. It's usually in people who have renal artery stenosis or arteriosclerotic disease. These patients can also have like thyroid disease, and that's why it's important when a person comes into the office to do the proper assessment, like collecting blood work and testing the thyroid, making sure they don't have any secondary problems. The white coat hypertension is when a person sees a doctor or a medical staff in a white coat. When they come to the hospital, doctor's office or hospital, their blood pressure goes up. And it's important to get more than one reading. Just taking one reading, and you want to do this in each arm. And also, let the patient go home and keep a chart. Also, making sure that we have different cuff sizes: small, adult, medium, large, extra large. They come in different sizes. Hypertension prevention. When teaching about hypertension prevention, these are going to be your healthy patients that's coming into your office. Sometimes they may come in for a physical. Sometimes they may come in just to have their job sitting there. And you want to educate these patients on, if they don't have high blood pressure, how to prevent getting high blood pressure. I know our younger generation tend to eat more fast food. They're overweight, and they haven't been diagnosed with high blood pressure just yet. So it's important to teach them about becoming healthy. Obtaining a full history and physical is essential on all patients that come into the clinic. Asking them, do they have a family history of high blood pressure? Has anybody had a stroke in your family? Measuring the patient and getting a BMI. Ask them about the alcohol consumption, because all these can contribute to leading up to high blood pressure. But if we could get on top of this and teach them before it happens, then it can be another life saved. To avoid hypertension, a hypertension diagnosis, make healthy lifestyle choices. Telling them about eating more vegetables, eating more fruit, taking their lunches, exercising, putting down their cell phone and going for walks, sometimes jogging with a friend. Just letting them know how they can prevent high blood pressure. Exercise, diet, and healthy weight. A lot of times when your patients come into the office, and I know I've experienced this, I don't know about if anybody else have, but when you ask them, do you exercise? And a lot of times they say, yeah, I exercise. I walk into the kitchen, get me something to eat, and exercise walk back to the couch and with the remote control and look at TV. But we really need to be serious about making sure they understand the importance of exercising. Exercise is any physical activity that increases your heart and breathing rates, and is considered aerobic activity. And believe it or not, household chores such as mowing the lawn, raking leaves, gardening, scrubbing the floors. I remember when my parents, when we were little, they had gardens, and they would get out in the evening time and they would work in the garden after the sun went down, or early in the mornings. Sometimes my mom would get out in the yard throughout the day and she would rake, and she would, always had something to do. But there are other things that we could do, we can teach them to do too, and that's like swimming. I know my friend, they just opened up, they started doing aerobic exercises in the water. It's a business that they started, and they're going around to the different assisted living facilities trying to get the patients the residents more active in something different where they're not bored, and they can actually do this without feeling a lot of pain. On the right, I have listed, according to the National Institute of Health, the BMIs, appropriate BMIs for people. And this could be according to your height also. But when a person come to the facility, we will have a list of what their weight should be for their height. I know my preceptor is really big on making sure that we get those BMIs when the patients come in. So she has it set up, once you put the weight in, it calculates according to their height. And in the right-hand corner, I put a DASH diet for healthy blood pressure. A lot of people like to eat, so there's something there. Complications of hypertension can cause lifelong disabilities. I know several friends that I've had in the past whose parents have either passed away or suffered a stroke or a heart attack. And an elevation of uncontrolled blood pressure is considered a hazard factor for a scope of cardiovascular occasions, including coronary illness and stroke. And if you look at the bottom of my list, I've listed some items, showing things that can develop from having for the controlled hypertension. I know some people will say, well, I took my blood pressure yesterday, but I didn't take it today. I haven't had time. And that should be one of the first things you do in the morning. Just go ahead and take your blood pressure medicine. I try to tell the patients to go ahead and, once you brush your teeth, just put your medicine in and it's gone about your day. Some patients come in the office and they say, I stopped taking my blood pressure because I haven't had time to go get my refills, or I haven't had time to come in and make an appointment. And that might be true, but we need to let them know that during the time that they don't have their medicine on board, they're setting themselves up for a heart attack or a stroke, something that can really keep them from having to be able to work. You know, it can cause them to have poor vision. You know, it can affect their heart. You know, a lot of people can develop heart failure from not taking care of their blood pressure properly. Some comorbidities such as diabetes, obesity, and elevated cholesterol can increase chance of cardiac event. And there may be times when we need to set up an education class for these patients. I know at the hospital, whenever we have a patient come in with diabetes, whether they come every other month, we still get the diabetic educator involved. We have some people that come in that's had diabetes since they were children, and they come in, they still talk to them and let them know, hey, this is what's going on, because diabetes, along with high blood pressure, is bad. You know, it can affect some of the major organs in the body, such as the heart, the kidneys, and also it can affect the eyes and circulation. You know, circulation is really a big one. If a person's heart can't pump properly due to heart failure, it affects their blood flow and it causes edema. And if they have diabetes, they already have poor circulation, sometimes from neuropathy. So if it's someone that we're having a hard case, don't be afraid to refer out to a specialist. And I put pictures up there just so you can see for diabetes, heart, and kidneys. Treatment plan. The treatment plan must be individualized. What works for one might not work for others. And as we have learned with JNC8, that there are guidelines advised for higher blood pressure, and these guidelines is there to assist us in properly treating patients. Non-pharmacologic measures like lifestyle modification. I made a list where it say weight loss, you know, physical activity, reduce salt, stop smoking, and then I saw this where it said the elderly should be warned about caffeine. And I know a lot of people, when patients come in the hospital, they want coffee all shift. You know, sometimes we're going back and forth bringing them coffee, but we need to make sure that they are aware of how this can affect their blood pressure if they're in with high blood pressure. Pharmacologic treatment, and that's going to be, you know, we know that's going to be our medicines. And like I said, JNC8 have guidelines specific for this and recommend we learn this. And if not, even if you can't learn it, just keep it handy as a tool to refer back to. When I'm in my precepting, I'm surprised that some of the other students do not know about JNC8. I was like, that's one of the first things they taught us, but I don't mind sharing it. So a lot of times I share it with them, and they're amazed about the information. And sometimes people are learning at a fast pace that they just don't remember everything. I know sometimes I get that when I have to go back and look over and over again. Learning this protocol will be beneficial for our patients and also to help us. You know, the better we treat them, they go tell someone else. And also listed right here another copy of the protocol, the guidelines. And this guideline is for adult age greater than or equal to 18 years of age. And then I put here the different types of medications. You got your thiazides, your calcium channel blockers. And then the second and third line are ACE inhibitors and ARBs, thiazides and diuretics and calcium channel blockers. Now, remember, when you're taking care of a patient of African descent without chronic kidney disease, try to use a calcium channel blocker and a thiazide instead of ACE inhibitors due to the risk of angioedema. I read an article when my mom had suffered with angioedema and she almost died. I was shocked at how many people actually go to the emergency room to get treated for angioedema after being started on an ACE inhibitor. And that right there alone can affect the healthcare costs. And then also, patients will become scared to even take another blood pressure medicine. So we got to be careful and make sure that we are knowing these recommendations. Isolated systolic hypertension is a blood pressure that is usually found in elderly population with the numbers of 160, over 90 or greater. When treated in the proper time, it prevents a serious cardiac event. So it's good to know about the isolated systolic hypertension. I thought I would mention it here as an education tool, since we are talking about high blood pressure. And at the bottom, you can see I have a chart right there. Sometimes it's good to try to have stuff like this to give out to the patients, because I feel like if they can see it, then it gives them more of a realistic, that we're not just telling them something. They can actually see it for themselves. In conclusion, goals for the patients and the providers. Let's instruct the patients to keep a record of blood pressure measurements, associated symptoms. Let them know that some of the things they might experience if their blood pressure is too high, such as chest pain, such as forgetfulness. Before I got diagnosed, I couldn't understand why I could remember. Like, I would be reading something and it just I couldn't focus on it. So once I finally went to the doctor and told them my symptoms, they checked my blood pressure and started me on a blood pressure pill. And at first, I was not started on the right medicine. After I started to learn about the different types of medicines to treat blood pressure, I went back to my doctor, who would not change my medicine. Then I went to a different doctor who agreed with me and decided, let's just start you on the calcium channel blocker, which that's what I'm on. And I've been doing pretty good with that. Have them to write down a 24-hour meal for 1 week. Sometimes when a person feels like they come into the doctor for that one day, they would try to eat healthy, or they would try to, cut back the fat. Let's just go ahead and get them comfortable and tell them to write down everything that they eat for that whole week. That way we can kind of move around. A lot of times I don't like to tell patients what to eat and what not to eat, because I do want them to enjoy some of the things that they enjoy. But I do try to let them know, hey, let's substitute some things. If you look on the right side, I put there, be an example. We need to be healthy. When I was looking for my physician online, when I walked into the office, I thought I was in the wrong office, because she did not look like the picture online. And she told me that she had to do a lifestyle change because she was developing diabetes and hypertension, and she couldn't tell her patients to change unless she changed. Encourage the patients to take the medicines. Let them know that we're monitoring them and we care about them and we really want them to be healthy. Praise the patients. When they stop smoking, let's praise them. If they lose 3 pounds, say, hey, you lost 3 pounds. Keep up the good work. Let them know that we are watching. And refer. If you have to refer out, refer. This is additional information. The USPSTF recommendation screening for high blood pressure in adults ages 18 years or older. And that's why I say I was trying to work on my son, but just the process that we have to get in the habit of telling young people, hey, let's go ahead and try while you're young to stay healthy. Let's go to the gym. Let's stay active. We know that they have stressors too, but we still want them to know that they still have a chance to prevent your hypertension, or either later on in life, as they get older, they may not even develop high blood pressure. Also, ambulatory home blood pressure monitoring. This right here helps to diagnose them to see if they have white coat syndrome, because it is a real diagnosis. Um, Thank you for sharing my PowerPoint and listening to me today. I hope you have enjoyed the PowerPoint. Right here are just some references that I added to kind of assist in if anybody need any information about what I had said, more references. Thank you and have a good night.